So the Robert Wood Johnson Foundation and the HPRS program has enabled me to think about a wicked problem, which became a catalyst to forming my dissertation research. Um, I was interested in elevating the efforts around data disaggregation and why it is such a powerful policy lever to advance health equity, especially in my work and interest in reducing health disparities and inequities among our Asian American, Native Hawaiian, and Pacific Islander population. In HPRS, we learn the fundamentals of the policy process, as well as translation, dissemination, health equity, et cetera. Not only did we learn about those concepts and tools, but we were able to apply those tools and use them in practice. And how we did that is like whether it was writing a policy memo, presenting these issues to stakeholders, or even conceptualizing a dissertation topic. This was beneficial in ways that forces me to dig deeper into the issues and be able to integrate equity and the related concepts into a very thoughtful piece. HPRS was also a safe place for me to share my work with my colleagues and get constructive feedback. And to be in this space, we were able to gain perspectives from outside of our own disciplines, and at the same time, have a collective experience of navigating and celebrating through this academic and professional journey. HPRS has helped shape my dissertation research by making me think about framing, the structures, the policies that have significant impact on the specific issue. In my research, I aim to build a narrative that explores the intricacy of health disparities experienced by our Indigenous Pacific Islanders and interrogating those policies and structures that put these groups at a disadvantage. Therefore, HPRS has shaped me and trained me to become a scholar, a voice, and an advocate to take on the most challenging work. The way that I think about this question is beyond the scope of the HPRS program, learning about leadership and developing leadership styles is an ever-changing process. There's no one true theory or model that can be independently applied into practice. And I think an effective leader engages all theories and models and finds what fits best with practice and fine-tuning. This program has made me assess what my strengths and weaknesses are, not only in the context of leadership, but also as a person. For example, we had exercises that assess personality types, and I figured out whether I'm an introvert or an extrovert, whether I'm task or relationship oriented, which allowed me to see myself from a critical lens, and I use it as a tool to develop my skills into a better leader and a better person. I learned that my strongest leadership quality about myself through this program was that I thrive in group and collaborative settings, and that I care about the development of my team members and the relationships that I build. This fits well in my field in public health, where the people and the work are very diverse, inter-organizational, transdisciplinary, and always constantly evolving. And I learned from the Robert Wood Johnson Foundation and the HPRS program is to be proactive in collaborative ventures and to actively reach out to our communities and resources. To simply put it, my advice to a scholar entering the program is to be willing to learn from yourself and from others. I think while we're training to be experts in our respective disciplines and field, we are privileged with the support and resources of HPRS to be part of a conversation with many other rising scholars and seasoned experts. Navigating through a doctoral program can be like very tough. And I think we often lose sight on ourselves physically and mentally as we try to perfect our craft. When we learn to better understand ourselves, we also learn to better understand others. HPRS as a social space can be a source of personal and collective strength that can make the journey of our academic programs and building a culture of health to be much more rewarding. I envision a culture of health to not just be a goal to work towards, but really taking the principles of the framework and to engage them in the work that we do. As a leader trained in the HPRS program, I hope to sort of become a viable resource for individuals and groups by helping to elevate their unique perspectives and to foster innovative, community-driven, and engaged efforts to advance health equity and improve health outcomes. There is power in cross-sector collective work, and the beauty of this program is access to the diverse network of people and resources that have the capacity to achieve the collective goal, a culture of health. I can truly say that participating in HPRS has been complementary to my doctoral training. I think one of the most valuable things that I've gained in this program is the web of connections, again, to the vast and diverse network of RWJ. This is including my cohort mates, to the leadership of the program, the mentors and coaches that they've provided us. These connections have led to friendships, collaborations, and new opportunities. And I believe that HPRS was really intentional with selecting scholars from diverse backgrounds, disciplines, and experiences, and that they've created this space to converge everyone's passions and work, to give us the opportunity to get feedback, to listen from different perspectives. And I think that definitely makes our own work stronger. And you don't realize how much of your own work overlaps with others. And that is the way that I think RWJ and HPRS envisions building a culture of health by breaking down the silos, working across sectors and disciplines. And then all the training and tools were helpful in pushing meaningful work at a policy level, where I think has the most impact as it cascades downstream. I think participating in HPRS has helped me achieve my goals by allowing me to take the time to carve out my own path and to celebrate each milestone, big or small, alongside others on similar journeys. HPRS has been a source of accountability, a think tank, a place to stimulate our everyday inquiries about society and how to make it a better place. And I guess just, again, having that network of people allows us to think about our potential as we go out into the field and work and become these professionals we envision ourselves to be once we graduate from our program.